One of the cases that we've recently started looking at are cases involving individuals who have Biomet hips. There's different kinds of Biomet hips, and what we're looking for are cases where people have metal on metal Biomet hips. The model that we see most often is something called the Magnum. The problem with these hips is that because of the way they're manufactured and have been designed, the ball and the cup actually have excessive wear and tear on them. And what that does is it releases metal particles into the hip joint. The big problem, there are two big problems with metal particles in your hip joint. The first is that the metal can actually destroy soft tissue. And when I say destroy soft tissue, what I'm talking about are muscles, tendons, and it can actually inhibit bone growth as well. So the clients that we have, what we've noticed is they typically go to their surgeon complaining of pain, sometimes clicking and clunking. The surgeon will do an x-ray, and the problem with an x-ray is that it doesn't show the soft tissue damage. So many of the surgeons have been sending their clients or their patients off, telling them that there must be something wrong with their back or their muscles, or basically blowing them off and blaming other things for the pain that the person's experiencing. It's only after the person gets what's called a cobalt and chromium blood test that the true cause of the pain can be determined. And what this is the blood test that can be done to determine whether you have these metal particles being released into your hip joint. And so we have been encouraging all of our clients and people who call us who have Biomet hips to get that test done. That's the most important thing. That will tell you whether you have this excessive wear and tear on your hip. The second problem with these metal particles is the systemic effect that high levels of cobalt and chromium have on your body. There's a lot of concern out there about cobalt and chromium causing cancer, causing heart problems, causing problems with thyroids. And some of our clients who have contacted us have had those problems. Additionally, rashes. We've seen lots of skin issues. Whether those things are directly linked to the cobalt and chromium, science is still out. They're still doing studies on that. But like I said, we have many clients who have contacted us that seem to be having those problems. So what we've encouraged people to do is, if they have a Biomet hip, to insist that they have their metal levels tested. And if they are high, to talk to the surgeon about potentially having the hip removed. Because what's really important is that the hip be removed before you have soft tissue damage. Because once you have muscle destruction, tendon destruction, then the next hip that's put in is not going to perform very well. And that's well established. So most of the surgeons that we've seen for our clients are being very aggressive with these hips. If the cobalt and chromium levels are at an alarmingly high level, they're taking them out. So if you have a Biomet hip, it's very important from a legal standpoint to protect yourselves. I recommend to anyone who has one of these hips to contact a lawyer immediately. Most states have a 2-year statute of limitations, and if you have a Biomet hip, I think it's safe to say that that clock will start to run on the date that you find out you have elevated cobalt and chromium levels. It's also important to know not all states are 2 years. Some states are 1 year. So it's very important that you contact somebody right away in order to protect your rights going forward.